Hello and welcome to the fourth episode in our series on neurodevelopmental disorders. In the previous episode, we understood some fundamental concepts related to a neurodevelopmental disorder called as ADHD, that is its definition, symptoms, vulnerable population and the prevalence. In this episode, we will try to understand more about the clinical aspects of this disease. Come, let us meet our expert.
ADHD is diagnosed basically based upon the symptoms or the behavioral manifestations that a person has. So generally, mental health professionals can diagnose ADHD. So what they do is they look at the different kinds of behavioral difficulties or trouble with the day-to-day functioning that a child or an adolescent has, and based on those manifestations, they see whether they can pick up features of inattention, hyperactivity and impulsivity, as we spoke about earlier. And if they are there, then they put together those signs and symptoms to say that a person has or does not have ADHD. It's important to understand that any neurodevelopmental disorder is not very like some of the other mental illnesses. So let's say depression or schizophrenia or bipolar disorder, some commonly heard mental illnesses that we talk about. Mental illnesses, when they are treated, the medicines are able to completely control the symptoms, and the symptoms go away. When we look at neurodevelopmental disorders, it is not the same thing as having a mental illness. So what we do in terms of treatment is that we try to decrease some of the manifestations or some of the difficulties that a person has with the use of some medicines or with the use of training, with the use of making this person practice a set of techniques, a set of strategies through which the developmental disorder will not impair their functioning to a considerable extent. So in that sense, so it's something like this, that a person has some developmental difficulties. As they grow older, the developmental difficulties are likely to come down. So definitely the severity will not be as much as it was early in childhood or adolescence. It will come down. And through this time of growth, whatever manifestations are there, whatever difficulties a person has, treatment helps them to figure out what is the best way to cope. So if a child has to cope with schoolwork and they are right now finding that they are not able to pay attention, not able to complete tasks, then what can the child do differently? What can the parent do? What can the teacher do to help the child overcome that developmental limitation? And as they grow older, A, the severity comes down, and B, they learn more and more about strategies to help them, with the developmental difficulty. The signs and symptoms of ADHD and the difficulties that ADHD poses can be substantially assisted with, treatment with different kinds of interventions. There are medication, and these are medicines that essentially help the brain to focus better, to help sustain their concentration better. So with the use of these medicines, children and adolescents find that they are able to sit and complete their tasks better. They are able to participate in different activities for longer periods of time. So these are medicines that can be used to help with the attention span. And once the attention span becomes better, then a whole lot of other difficulties with ADHD also become lesser. For example, impulsivity or fidgetiness, hyperactivity, a lot of those things can also reduce with the use of medication. The other forms of treatment include behavioral management. And by behavioral management, what we mean is that how can an individual or others around the individual help the individual to concentrate better, to reduce their tendency to move around or be impulsive in their decision making better. So it involves becoming very aware of what my difficulties are, where my problems are, where I'm finding a difficulty in terms of doing my day-to-day tasks, and then what can I do differently. For instance, if a child finds it difficult to concentrate in class, Simple things like making the child sit in the front of the class, the teacher intermittently checking with the child, giving the child very small portions of tasks and helping them to go through those, and reinforcing and rewarding the child for completing smaller bits of tasks to ensure the complete task completion. So these kinds of strategies can be evolved to behaviorally manage the features of ADHD. Also, the environment that a person is in can substantially affect the manifestations of ADHD. So for example, if the room that the child is sitting in is very distracting, there are too many things, there are toys and books and a whole lot of other things around in the room, then the child may feel more distracted. So if the space itself is made more conducive to completing the task, then a simple thing like that can also help with the management of ADHD. So there are medication, there are behavioral strategies, and then there are also environmental modifications that can assist with the management of ADHD. It's very important to understand what untreated ADHD can do. And in fact, a lot of time when we are discussing treatment options with parents, they ask us that, is it important for my child to take medicines? What will happen if he or she does not? Or, is it important for the school or for me or for anybody else to make the kind of modifications that you're saying? And every time our answer is yes. So it is important to treat ADHD. See, what happens is that children with ADHD, they most of the times, their intelligence is good. So actually their capacity to learn is, just like any other child of their age. But what happens is that because of the ADHD and because ADHD makes their attention span lesser, makes their ability to stay with the task lesser, so in a way it interferes with how much they could have learned and how much they could have, enhanced their skills through the different environments that they're in. Right? So in a way, ADHD can create an impediment to the maximum learning potential that a child has. One is that. The second is, of course, because ADHD tends to make a child impulsive, tends to make them very, some people feel that the child may be quite unpredictable in their behaviors. All of this can interfere with the socialization of the child as well. So it may be difficult to sustain friendships. The child may get a lot of negative remarks from the teachers. The child may even experience bullying, right? Because other children may find that the child has certain odd behaviors, or the child is very restless, tends to be a little different from everybody else around them. So it can create a lot of social challenges for the child, which again can have emotional consequences and will also have long-term developmental consequences, right? So the reason to treat ADHD is first and foremost to maximize the learning potential of the child, and B, to facilitate social adjustment for the child. Because in both of these spaces, ADHD can limit a child's abilities.
This concludes the fourth episode in our series on ADHD. In this episode, we understood how ADHD is diagnosed, whether it is curable, what are the treatment options, and what happens if ADHD is untreated. We'll be back with our next episode. Namaste.